Hello students, we will see a topic on safety transfer of patients. A patient transfer is a deceptively complex process with three distinct phases in the hospital setting: preparation for transfer, physical transport of the patient, handover of the patient to the receiving staff. While patient safety is a primary concern for all radiographers, it is also important to ensure our own safety as we care for patients. It is also our duty to be familiar with the established safety procedures for our employment situations. Fire safety. Fire is caused by three main components, that is spontaneous combustion, open flames, and electrical fires. Spontaneous combustion occurs when there is a chemical reaction near a flammable materials which will cause a sufficient heat to generate a fire, and open flames is an uncontrollable burn, and it is the most common source of fires in homes. And electrical fires, it is the potential sources of fire hazard and are of a special concern in radiology department. So if there is any presence of fire, we must know this protocol, that is RACE. R stands for rescue, which will coordinate with nursing staffs and remove patients from danger by moving them past at least 2 fire doors within the facility. If there is any larger fires, we must follow the instruction of coordinating personnel. And for A, alarm. We must activate the alarm system directly or use the hospital call code for fire. And we must make sure that all personnel in the area are aware of the fire, and we must be very careful to the patients so that they do not panic. And C, contain. Whenever there is a fire, we must know this containment. We must close any doors to limit the oxygen supply to the fire and to prevent the spread of smoke and heat. And we must make sure that oxygen valves and electrical circuit breakers are turned off. And we must close the doors to the patient rooms. And E stands for evacuate, extinguishing. For small fires, use the available fire extinguisher to put out the fire or smother the fire with a blanket. And if there is a larger fires, evacuate the area and wait for the fire department, fire personnel. So we must know how to use the fire extinguisher. So we must pull the pin of the fire extinguisher, aim at the base of the fire, squeeze the handle, sweep from side to side. So this is the fire extinguisher and how to operate them. In case of falls and collisions, we must reduce the risks of falls and collisions in inside a hospital, as it is a major safety concern for the patient. In case of any chemical spills, working areas should have a spill kit that include nitrile gloves, a 80-liter container, and heavy plastic bags, a broom and a dustpan. And we must follow the cleaning measures to avoid potentially serious problems. Darkroom chemicals. Occupational Safety and Health Administration requires that all personnel workers must wear protective aprons, splash-proof goggles, and nitrile gloves when preparing or cleaning up film processing solution inside a dark room. For eye splash and eye wash protocol, there should always be an eye wash stations in the first aid stations, which will provide a spray of water to the eye from a convenient height. And we must if there is any presence of eye splash, we must flood the eyes with water for at least 5 minutes. And if there is a continuation of discomfort or impairment in vision, we must consult an ophthalmologist. So for transfer of the patient, we must know the body mechanics, which is called as ergonomics. It is the study of the human body in relation to the working environment, and we have 3 concepts, that is base of support, center of gravity, line of gravity. So for the base of support, it is the portion of the body in contact with the floor or other horizontal surface, and it is represented in a horizontal line between the feet and the body when in erect position. This broad base of support provides stability for body position and movement. For center of gravity, it is the center of the body weight where the whole body weight is balanced, and it is located in the mid portion of the pelvis. And any object you hold adds to the weight on the base of the support. So size and position may affect the location of your center of gravity based on the object that you hold. So the body is most stable when the center of gravity is nearest at the center and is nearest at the center of the base of the support. So the third one, line of gravity. It is an imaginary vertical line passing through the center of gravity, and the body is most stable when the line of gravity bisects the base of support. Positioning for safety and comfort. We have supine position, we have prone position, we have lateral recumbent, we have sims, we have folders, we have semi-folders, we have Trundleberg, we have knee chest, and we have lithotomy position. For patient transfer, patient transfer refers to the movement of patients from one place to another inside a hospital, or a hospital to another hospital. Method of transfer is to use a wheelchair or stretcher. Bed transfer can be done for very sick patients. Crib can be used for infants, and premature infants are transported through isolation. And special considerations must be made in case of strokes, fractures of extremities, joint replacement, any post-operative patients, paralyzed patients. So before we transfer the patients, we must prepare them. First, we must check with nurses and check the patient identification, tell the patient what we are doing, and we are going to enlist the patient help and cooperation, and we must obtain equipment and check them, and we must plan the action and the working areas and obtain additional help when needed. Wheelchair transfer. We must start by lowering the bed and elevating the head of the bed, and wheelchair should be parallel to the bed with wheels locked and footrests lifted. And we must take a moment to assist the patient with slippers and rope. Stretcher transfer. The stretcher transfer is also sometimes called as a cart or a gurney, which is used to transfer patient who is unable to stand safely. And this gurney is adjustable for the height to the table, and so that we can keep it parallel. And we have two methods, that is jaw sheet transfers. A sheet is placed under the patient, and then at one at a time the patient is transferred from the gurney to the bed, or the bed to the gurney. And then we have a slideboard transfer, which employs a strong sheet of smooth plastic large enough to support patient's body with handholds cut into edges. Mostly this slideboard transfer is used in trauma patients. In this picture, we see that from the bed to the gurney, the patient is rolled towards her right side, and then put on the gurney, and then the patient lies in supine. And then for the patient to be placed in the bed, the patient rolls in the left side with left side down, so that she stays in lateral decubitus, and then from lateral decubitus the patient is turned into supine. For safety straps and rails, it is used to ensure that the patients will not fall or attempt to climb off without assistance. This safety straps and rails is very important when the patient is unconscious, sedated, intoxicated, or in shock. So if we encounter these kinds of patients, we must use safety straps and rails. Restraints and immobilization. It is used to prevent undesired motion during imaging procedures, and tape is used for infants. And for restraints, we can use compression bands, and for immobilization, sandbags. So these are some of the immobilization pads. And immobilization equipment for pediatrics, we have circumcision boards, 10M immobilizer, papoose board for children 2 to 6 years old, picostat, infant chair for infants. And lastly, for infants, we have mummy wrap technique. So this mummy wrap technique is used for infant immobilization. So the procedures for doing this mummy wrap technique is, first we must fold the sheet on the diagonal to make a triangle. So that first, that means we must make a triangle first. Wrap one corner up over an arm, and then tuck it under the body and pull it through the other side. Then again, wrap the first corner across the chest and around the second arm and tuck it under the body. And then we can wrap the second corner over the chest and secure it under the body. And we can, by that process, we can complete the mummy wrap by securing the second corner around the child. In case of accidents and incident, we must make a report. We must inform the department supervisor immediately and keep any record of any unusual circumstances. So for conclusion, be very conscious of hazards and plan to avoid accidents, and knowledge of safety procedures to the radiographer is a must. And when an accident or something unusual occurs, protect your patient, yourself, and the department, the equipments, by responding appropriately. Thank you.